It usually happens suddenly. You feel a deep, agonizing, stabbing pain wedged directly underneath your left shoulder blade. Within hours, that pain begins to radiate, wrapping around your ribs and shooting directly into the front of your chest. It feels tight. It feels heavy. You are terrified. You rush to the emergency room, absolutely convinced you are having a heart attack. The doctors hook you up to an EKG, they run blood tests, and they monitor your heart. A few hours later, the doctor walks in and tells you your heart is perfectly healthy. You are discharged and told to take some ibuprofen for a pulled muscle. But the pain does not stop. You go to a specialist and they order a thoracic MRI to check your mid-back, but the scan comes back completely normal. You feel like you are losing your mind. If you are experiencing this terrifying cycle, you are not crazy and the pain is not in your head. You are trapped in a massive medical misdiagnosis. Your heart is fine and your mid-back is fine. You are experiencing referred pain caused by a crushed nerve hidden high up in your neck. Today, we will explain exactly how a neck injury mimics a heart attack and how we can permanently shut down the false alarm. To understand why your chest hurts when your neck is a problem, you must understand the complex electrical wiring of the human nervous system. Think of your spinal cord as a massive bundle of electrical cables. At every level of your spine, specific cables exit the main bundle and travel to different parts of your body. In your lower neck, specifically between the C4 and C7 vertebrae, several highly critical nerve cables exit the spine. One of these is called the dorsal scapular nerve. Another complex network is the brachial plexus, which controls your chest, shoulder, and arm. In a healthy spine, these electrical cables transmit clean, normal signals. But your cervical spine is highly mobile, carrying the heavy weight of your skull. Over time, the rubbery shock absorbers, your spinal discs, dehydrate and collapse. If a cervical disc herniates, or if an arthritic bone spur grows into the nerve tunnel, it physically clamps down on that specific electrical wire. It crushes it. The brain receives a massive, chaotic distress signal from the crushed cable. But because that specific wire travels down through the shoulder blade and innervates the muscles of the chest wall, the brain gets confused. The brain assumes the chest is being damaged. The hardware in your chest is perfectly fine. The short circuit is happening inside the breaker box in your neck. This anatomical overlap leads to a disastrous loop of wasted medical treatments. When a patient complains of pain between the shoulder blades, local doctors almost always order an MRI of the thoracic spine, the mid-back. They spend weeks looking for a herniated disc in the middle of the back. But thoracic herniations are incredibly rare because the rib cage naturally locks the mid-back in place, preventing extreme movement. When the thoracic MRI comes back normal, the doctor assumes the patient just has a bad knot in their muscle. They send the patient to physical therapy for aggressive deep tissue massage, or to a chiropractor to aggressively crack the middle of their back. This is a profound waste of time. No amount of massaging the shoulder blade will cure the pain, because there is nothing wrong with the shoulder blade. You cannot fix a crushed electrical wire in the ceiling by massaging the light bulb on the wall. We cannot solve this mystery by rubbing the muscles or guessing. We must act as elite medical detectives and trace the electrical wire back to the source. Once the heart is cleared by a cardiologist, an elite neurosurgeon will immediately pivot and order a high-definition magnetic resonance imaging scan of the cervical spine, the neck. When we evaluate the cervical MRI, we do not just look for massive, obvious disc explosions. We are hunting for millimeter-specific compression, specifically at the C5, C6, and C7 levels. We look at the axial, top-down view to measure the neuroforamen, the bony tunnels where the nerves exit. We must determine if a soft disc fragment has leaked out and is chemically burning the nerve root, or if a hard, calcified bone spur has slowly grown and choked the tunnel. We correlate the exact millimeter of the compression on the MRI with your exact symptom. If the C5 or C6 nerve root is choked on the scan and you feel stabbing pain under your shoulder blade and chest, we have a perfect mechanical match. The mystery is solved. Because the chest pain is simply a false alarm caused by the neck, our entire treatment protocol is focused exclusively on releasing the pressure in the cervical spine. If the MRI proves that the compression is caused by a contained soft disc bulge, we avoid open surgery entirely. We utilize ultra-minimally invasive techniques like percutaneous laser disc decompression. Under local anesthesia, we guide a microscopic laser fiber directly into the dying cervical disc. We vaporize a tiny fraction of the internal pressure, creating a vacuum that pulls the bulge away from the nerve. If the compression is caused by severe bone spurs or a ruptured disc fragment that has fallen onto the nerve, we use advanced cervical endoscopy or microdiscectomy. Through a tiny, precise incision, we use high-definition cameras and microscopic instruments to gently shave away the overgrown bone and remove the disc fragment, physically freeing the trapped electrical cable. The moment the nerve is released, the blood flow returns, the false electrical signals stop, and the terrifying stabbing pain in your chest and shoulder blade permanently vanishes. Many patients with this condition live in a state of chronic terror. They accept the daily agony because they are paralyzed by the fear that their heart is failing, or they waste thousands of euros on endless chiropractic adjustments and chest scans that yield absolutely zero answers. But let us look at the true cost of getting this wrong. If you ignore a severely crushed nerve in your neck, it will eventually suffer permanent, irreversible damage. You will lose the strength in your arm, the pain will become chronic, and the nerve will die. You are risking permanent neurological damage because your local doctor is looking at the wrong half of your spine. For a fraction of the cost of a useless thoracic scan or endless physical therapy, you can have an elite neurosurgeon review your imaging, potentially saving your nerve and ending the panic immediately. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a solution to your pain. But you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comment section. If you have an MRI, Do not just read the paper report. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, trace your pain back to the source, and build your personalized, minimally invasive treatment plan. Stop living in pain and stop guessing. Let us find your solution today.